Hello everyone, my name is Arushi Gupta. I am a 4th year medical student and today we are going to talk about how to differentiate between upper motor neuron lesion versus a lower motor neuron lesion. So as we can see, I have written 3 points over here which distinguish upper motor neuron from lower motor neuron. So first of all, let's talk about what do I mean when I say upper motor neuron. Upper motor neuron means anything which is related to your central nervous system, that is your brain and your spinal cord. Now, the lower motor neuron consists of everything which is coming out of the spinal cord, which is individually reaching each and every muscle group. So, let's talk about upper motor neuron injury. So, in case a person suffers an upper motor neuron injury, for example, in case of a traumatic brain injury, the symptoms that we see include spasticity, increased reflexes and weakness in the muscle groups. Now, let's talk that why do we see so? So, when you have upper motor neuron function, it basically inhibits any extra movements that your body can have. So, if you have damage to these neurons, what will happen? The inhibition will get lost. So, if you do not inhibit a group, it acts on its own. So, that's why you have increase in reflexes or hyperreflexia. Now, again, there's no inhibition, so you can have twitching. We refer that as spasticity. And last but not the least is weakness in muscle groups. So now going on to the lower motor neuron injury, for example, if someone suffers a lower motor neuron injury, they see flaccidity, decreased reflexes and weakness in individual muscles. So why is there decreased reflexes? So basically, if you think so, you are losing the nerve supply to a muscle. If the muscle does not have a nerve supply, it's not getting the signs, it's not getting the signal to respond. So if it's not getting it, what you get? You get a decrease in reflexes. Again, that causes flaccidity. And then why we have weaknesses in individual groups? Because as I said, each lower motor neuron supplies an individual group. It supplies an individual muscle. So when you are supplying an individual muscle, whichever muscle nerve is affected, that muscle will lose its function and it will cause weakness and atrophy. Now, we spoke about upper motor neuron versus lower motor neuron lesions, but there are a few diseases where you see both the symptoms. We have 3 of them. First is multiple sclerosis, second is ALS or amyotrophic lateral sclerosis, and the third one is cervical myelopathy. So for all 3 of them, how do you distinguish them? They all have symptoms of upper motor neuron and lower motor neuron lesions. So how do you differentiate is on the basis of at which stage of life you get these. When you talk about multiple sclerosis, it's seen in young adults, while ALS is seen in middle-aged people versus cervical myelopathy, which is seen in elderly. And when we say elderly, we are referring to people 65 and above. Thank you so much, and I hope this video helped you.
Observerships, doodles, CVs, interviews, we help you match stronger. Contact me at connect@drsinghmd.com.